Good afternoon, everyone. Thank you for joining us today. I'll start, as usual, with the update on the COVID statistics. I can report that an additional 160 positive cases were confirmed yesterday. That's an increase of 37 on the number we reported yesterday for the previous day, and therefore it is undoubtedly a concern to us. But it still represents less than 1%, 0.9% to be precise, of the people who were newly tested yesterday. And it takes the total number of cases now to 20,478. A full Health Board breakdown will be available as usual later, but the provisional information I have is that just 14 of the 160 new cases are in Tayside, where we've been dealing with the cluster involving the Two Sisters food processing plant, and just 4 of them are in Grampian, which I think is a further indication that the Aberdeen pub cluster has been contained, and my thanks to everyone there in our Test and Protect teams and the local incident management team for all the hard work that they have done. However, 69 of the new cases are in Greater Glasgow and Clyde, 27 are in Lanarkshire, 18 in Lothian, 9 in Forth Valley and 8 in Ayrshire and Arran. The remaining 11 are spread across 4 different health boards. Now, I'm going to say a bit more about these cases later, but let me give an assurance that the circumstances of them and any connections and patterns between them are being very carefully examined. As you would expect, we're paying particularly close attention to Glasgow and Lanarkshire and considering whether any specific action there may be required. I can also confirm today, though, that 258 patients are in hospital with COVID. That's 7 more than yesterday, and 5 people are in intensive care. While this is the same number as yesterday, it is worth noting that it is 4 more than it was a week ago, and that should be a reminder of how serious this virus can be. However, I am pleased to say that again in the past 24 hours, no deaths were registered of patients who had tested positive over the previous 28 days. So the number of deaths under that measurement remains 2,494. That total, of course, reminds us of the overall impact of COVID, and I want again to send my condolences to everyone who is grieving a loved one. I'm joined today by the Education Secretary, who will talk in a moment about face coverings in schools. The Chief Nursing Officer will also help us with questions. Before then, though, there are a few issues I want to cover. First of all, I want to give just a bit more detail on some of the main clusters that we are currently dealing with and the increase in cases that I have just reported. As I've already commented on, we saw quite high numbers of new cases, not just today, but over the weekend. That is partly a result of greater numbers of people being tested, and the overall proportion of positive tests was still below 1% over the weekend, which I think is an important bit of context here for everybody to bear in mind. However, the numbers of cases that we are seeing right now is a reminder to all of us that the virus is still a very real risk. It is a development that concerns me, and it is one that we are taking very seriously. We mustn't lose sight of how important it is, if we're to keep schools open, build economic recovery and retain a bit more normality in our lives, that we do continue to suppress the virus and push as close to elimination of it as we possibly can. But of course, the flip side of that is that all of that gets harder the more we open up the economy and society. And it takes more of a conscious effort on the part of all of us as we open up to keep the virus under control. Sticking to the restrictions still in place, particularly on indoor activity, is absolutely essential, and I cannot stress that enough. One of the features of the new cases we've reported in recent days is that not all of them appear to be linked to larger clusters. For example, the figures in Greater Glasgow and Clyde seem to reflect a number of small clusters rather than 1 or 2 more significant outbreaks. However, we are dealing with larger clusters in some areas. On the most recent figures, which will be updated later today, there were 188 positive cases in the cluster linked to Two Sisters in Cooper Angus, 164 employees of the factory and 24 of their contacts. All employees at the factory and their households should continue to self-isolate at least until the end of today. But if any worker or household contact has been given specific advice by the contact tracing team, they must follow that advice, especially if it extends the isolation period beyond today. The plant is currently due to reopen from tomorrow. Two Sisters are working closely with teams from the Health and Safety Executive, Food Standards Scotland and Environmental Health to ensure that reopening takes place safely. An incident management team is also looking at a cluster of cases in Ayrshire and Arran at the moment. That cluster currently has 22 positive cases, although that figure is likely to be updated later today. Contact tracing is underway, and many of these Ayrshire and Arran cases seem to be linked to indoor gatherings that took place the previous weekend. And that's a reminder of why it is so important to limit the number of people meeting indoors. Our advice is that no more than 8 people from a maximum of 3 households should be meeting indoors. The virus can spread easily across multiple households if larger gatherings are taking place. Finally, I mentioned on Friday that there's a cluster of cases in Hawick. The total number of cases in that cluster is now 15. All contacts are being followed up and self-isolation and testing has been recommended where appropriate. A mobile testing unit will be at the Teviotdale Leisure Centre car park in Hawick between 3 and 5 p.m. today and tomorrow and all day on Wednesday. It will also be available in Galashiels tomorrow morning for anyone who needs to get tested. These mobile units are actually relevant to the second issue I want to briefly touch on today. From today, mobile testing units in Scotland, which up until now have been run by the Army, will be taken over by the Scottish Ambulance Service. The change was first agreed in July, and since then the Scottish Ambulance Service has recruited almost 500 new people to run the units, and it has worked very closely with the military to ensure that those staff are able to take over operations. As we're seeing, mobile units are playing a hugely important part in making testing more accessible, especially when there are clusters of cases in rural areas, and it makes sense, therefore, to have the ambulance service take these units over for the medium to long term. I'm very grateful to all of the new ambulance service employees who filled these immensely important roles, and I also want to say a massive thank you to all of the Army staff who've been involved so far. Establishing and running the mobile units has been a challenging project, but a hugely important one, and the Army's hard work, professionalism and expertise has been greatly appreciated by me and everyone in the Scottish Government. Third issue I want to touch on today relates to perinatal mental health care, support for mothers and babies in the period immediately before and after childbirth. Improving this care has been a priority in recent years, and it's especially important now. The need for physical distancing during the pandemic has increased the chance of new mums feeling isolated. It's also made it more difficult for some third sector organisations, many of whom provide key perinatal services, to raise funds. So the Scottish Government is today announcing allocations from the Perinatal and Infant Mental Health Fund, which we established back in the spring. This will provide up to £1 million a year for the next 3 years to support 15 third sector organisations delivering perinatal mental health services. The funding will help to ensure that these services don't suffer as a result of the pandemic, and it will enable these organisations to help more mothers and babies and support their mental health and physical well-being. Now, the final point I want to touch on is that several more changes to our route map out of lockdown take effect today. Unregulated indoor activities for young people can resume. That's cubs and brownies, mother and baby groups, for example. In addition, gyms, swimming pools and indoor sports courts can reopen, although some facilities might take longer to get back up and running. I should stress that we're not yet permitting adults and young people over the age of 12 to take part in contact activity indoors. That must wait for a further review. The reopening of gyms and swimming pools is, I know, something that many people have been looking forward to, and it will be a major relief for people who work in the leisure sector. The reopening is a welcome further step in getting back to normal, and it's important for wider health and well-being. But it also obviously brings risks. There's no getting away from that, and that's why we have delayed this until now. And we are seeing, as I've just been talking about in our daily numbers, that as we release ourselves from lockdown, we release the virus from lockdown as well. So please, as always, in fact, this is more important now than it has been at any time up until now. Make sure that you follow the guidance that is in place wherever you are and for any venue that you are visiting, and cooperate with the staff working there. That's the only way we can make sure that these reopenings happen safely and that they don't spark an increase in transmission that will take us all back again. These are the key points I want to cover today. Before I hand over to the Deputy First Minister, I want to end, as always, by stressing the importance of the public health advice. The figures we're seeing just now for new cases demonstrate very clearly that this virus is still present across the country. The accounts we're getting of clusters show that it will spread very rapidly if it gets the chance. And of course, the admissions into intensive care in the last week, although still at a low level, nevertheless remind us that the virus is still immensely dangerous for some people. So please continue to make sure that you are not doing anything that gives the virus the chance to spread. When you're indoors, whether in someone's house or in a pub or a restaurant, do not meet in groups of more than 3 households and make sure there is a maximum of 8 people in any group. And physically distance yourself from people in other households. None of that is easy. None of that feels natural. I understand that. But as we see from all of the data we are looking at right now, not doing these things is giving this virus the chance to take hold of us again. And please continue to follow all of the facts rules. These are the golden rules that will reduce our own chances of getting or spreading the virus. So wear face coverings in enclosed spaces, avoid crowded places, clean your hands and hard surfaces that you're touching regularly, keep 2 metre distancing as a general rule, and remember to self-isolate and book a test if you have symptoms. It is absolutely vital that we follow these basic precautions. We are right now in a very fragile situation. The transmission of the virus is increasing again. We can keep it under control if we all do the right things to help test and protect do its work. But it would not take much right now for this virus to get a grip of us again. Every single one of us has a responsibility to try to stop that happening. So I'm appealing to everybody today watching to continue to do the right things, and I'm appealing to all of you to spread that message as widely as you possibly can. Thank you very much for listening to me today, and I'll now hand over to John Swinney before I and the Chief Nursing Officer take questions as normal.
Thank you, First Minister. I'd like to provide an update on 2 key issues today. Firstly, face coverings in schools, and secondly, some key points on the advice available to parents on the differences between the common cold and COVID-19 as it affects when to seek a test for a child. Last weekend, the World Health Organisation updated their guidance on face coverings for children and young people. I'm grateful to both our Scientific Advisory Group for Children and Education Issues and to the Education Recovery Group, who considered this revised guidance very carefully at the beginning of last week. They considered how the updated World Health Organisation guidance could apply in Scotland, along with the other mitigations that we have in place in our schools to make them safe environments for both children and staff. As a result, the Education Recovery Group worked together rapidly to update the school reopening guidance. This includes new advice on when face coverings should be worn by children and young people. This revised guidance comes into effect today, and I'd like to thank schools, local authorities and transport providers for making the necessary preparations last week. From today, face coverings should be worn in the following circumstances, except where an adult or a child and young person is exempt from these provisions. Where adults and young people in secondary schools, including special schools and independent and grant-aided schools, are moving about in schools, about the school in corridors and confined communal areas where physical distancing is particularly difficult to maintain, and where adults and children and young people aged 5 and over are travelling on dedicated school transport. Those are the 2 conditions in which face coverings should be worn. This approach reflects precautionary judgments based on the latest scientific advice and the experience of school reopening to date. It is limited to the specific environments which I have just described for the following reasons. These are areas where mixing between different age groups is more likely, increasing the potential for transmission of the virus. Experience and feedback has demonstrated that crowding and close contact in these areas is more likely, and that voices may be raised, resulting in greater potential for the creation of aerosols. The scope for effective ventilation is often less, and for school transport, The adoption of an approach to face coverings applying to children and young people aged 5 and over will be consistent with the current approach on public transport. Face coverings should not generally be required in classrooms or other learning and teaching environments. However, anyone, whether a child, young person or adult, wishing to wear a face covering in school should be permitted to do so. We will continue to keep our revised policy on face coverings in schools under review. For example, in future, face coverings may play an important role in if prevalence of the virus increases. Local incident management teams may recommend a further strengthening of the use of face coverings in the event of local outbreaks. We expect that most staff and young people will have their own face coverings to use. However, where anybody is struggling to access a face covering or where they are unable to use their face covering due to having forgotten it or it becoming unsafe, schools should take steps to have a contingency supply available to meet such needs. I'm working with our partners to monitor the supply and demand for face coverings for schools and local authorities on a daily basis. It will be important for schools to support young people to ensure that face coverings are used hygienically and safely. Our revised policy on face coverings does not change the need for the other key mitigations in the school reopening guidance, such as regular hand washing, to continue to be applied rigorously in all school settings. I'm pleased that we've worked with Young Scot to publish a version of this advice for young people, which has already been shared widely on social media. Many children and young people will have seen facts talked about on news or social media. The Young Scot material explains what it means for you and how you should apply facts when you are at school. The second issue relates to the clinical advice on seeking testing in relation to the distinction between common colds and the COVID virus. Following the return of schools after a prolonged break, it is common for colds and similar viral infections to circulate. In many cases, children will be well enough to attend school and continue their learning with little or no interruption to their education. In other cases, for instance where they have quite a heavy cold with a runny nose, they may need to take a day or two off to recover. This is not the case for children and young people with potential COVID-19 symptoms. They are required to self-isolate and to seek a test. In order to ensure that your child does not miss out on their education, it is important to be clear about how COVID-19 symptoms differ from those of other infections that we normally see circulating at this time of year. The main symptoms of COVID-19 to be aware of are a new continuous cough, a fever, a high temperature, loss of or change in the sense of smell or taste. If a young person or a child in your care develops any of these three symptoms, they should self-isolate and you should book them a test as soon as possible. It is essential that people who have COVID-19 symptoms or who share a household with someone who has symptoms do not attend school, nursery or childcare settings and must self-isolate along with all members of their household. If the test is negative, self-isolation can end for everyone. If the test is positive, Test and Protect will give you further advice. So in summary, we recommend testing only for those with a continuous cough, fever, or loss of or change in the sense of taste or smell. The UK senior clinicians continue to keep the symptoms for case definition under review and will continue to use evidence to adjust these if it becomes necessary. I'm writing today to local authority directors of education and schools on this issue, and the Scottish Government's National Clinical Director, Professor Jason Leach, has written an open letter to parents to reinforce this advice. We are working with the National Parent Forum for Scotland to share these important messages as widely as possible. In closing, I'd like to take this opportunity to thank children and young people, parents, carers and school staff for making the return to school so successful and for implementing the changes that we set out in our guidance so carefully. This is ensuring that all the benefits of face-to-face education are being experienced once again by children and young people and in a safe way.
Thanks, John. We'll move straight to questions now. Glenn Campbell from BBC Scotland. Glenn Campbell. If Glenn is not there, I will go to Kay Nicholson from STV and come back to Glenn if he manages to get connected. Kay Nicholson from STV.
Good afternoon. Thank you, First Minister. You mentioned the largest increases in cases in the Glasgow area. Can you give us any more detail on where these cases are coming from? And are you concerned they may also be linked to indoor gatherings, as you mentioned in the cases in Ayrshire and Arran? And also, this might be one for the Chief Nursing Officer. What are the challenges of tackling these smaller clusters in comparison with some of the larger clusters we've already seen?
Thanks, Kate. I'm not able to give too much more detail on these cases yet, other than the detail I've already given. We will see more detail and analysis of the cases over the course of today, and obviously we'll consider whether further action is required. What we do think, based on the information we have so far, is that the cases in Glasgow in particular are not related to one or two big clusters, but a number of smaller clusters, and that is indicative, although we have to wait for further analysis, of perhaps smaller indoor gatherings being the risky area in terms of transmission. I have no information at the moment to suggest connections between the Glasgow cases and Ayrshire and Arran. We think Ayrshire and Arran cases are related to indoor gatherings that took place a week past, last weekend, not the weekend just past. But again, all of this underlines how risky it is if we have large numbers of people from significant numbers of households meeting up indoors. There is a really good reason that we put limits or advise limits on indoor gatherings, so that if the virus is present and it starts to spread, then there is some inbuilt firewall to stop it spreading further. So I would appeal to people to keep these limits firmly in mind and abide by them, because as we go into the autumn and winter, we know that people are more likely to gather indoors, and if we don't make sure that the restrictions are being adhered to, then we do see greater risk of transmission getting out of control again. Fiona?
I think what it's important to remember is our health protection teams in boards are very used to dealing with outbreaks and infectious diseases and making contacts and giving people advice. The smaller outbreaks, you're correct, are sometimes more complex. Where it's a big outbreak associated with a pub or with a food factory, then the containment is quite straightforward. Where the smaller outbreaks are flaring up, then the reason that's happening is most likely people are not following guidance of social distancing, cleaning hands and cleaning surfaces, and therefore they are almost sleepwalking into catching the virus and then transmitting it. And what we do know is once somebody in a household becomes infected, it is very likely that the rest of the members of the household will also become infected. So that's why what we call backward tracing is incredibly important, so that the biggest aim is to contain the virus, so get the contacts, advise the contacts to self-isolate or book a test if they have symptoms, but also so that we can take an overview of what's happening and make the connections and join the dots. Then the contact tracers also look at what we call backward tracing. So where have people been, particularly since 24 hours, 48 hours since before their symptoms started, who did they meet with, did they socially distance, and then take that forward so that we can then get a sense of precisely where the infections came from, if at all possible. And as the First Minister's already talked about, often it is small informal gatherings at home, sometimes people who've returned from travel, or other areas where it's not immediately obvious, but with a bit of digging then we can find that out. So yes, a bit more complex, a bit more challenging, but our health protection teams are very experienced in this and are doing an incredibly good job.
Thanks. I'll go back to Glenn Campbell from BBC.
Hopefully better luck this time. I wanted to ask about the programme for government. I know you're announcing that tomorrow and that it will have much to say about economic recovery, but I wonder if you can say today if you find any merit in any of the proposals that the Scottish Conservatives have put forward, in particular the idea of having a hardship fund equivalent to furlough where businesses are forced into local lockdown.
I'll set out the programme for government tomorrow, and you know the reasons why it's not possible for me to do that right now. I don't mean this to be a disrespectful comment in any way, but I've been pretty consumed this morning in analysis of the COVID figures and preparing for this briefing. I've not had the opportunity to look in any detail at the ideas put forward by the leader of the Scottish Conservatives. I'm always happy to look at ideas wherever they come from, and if they're good ideas, then we'll consider what we can do to take them forward. So we'll operate on that basis. In terms of further support, for example, to carry on the furlough scheme, I am firmly of the view that it is essential for the furlough scheme to continue. Ending that at the end of October is almost guaranteeing a wave of avoidable redundancies, and I think it would be unconscionable to allow that to happen. So I think the furlough scheme should be extended, following the lead of countries like France and Germany, for a period of a further 12 months, and that is particularly important for sectors that have been hardest hit and have the longest path to recovery. And it's also important that we see the continuation of support for any areas that may require to have restrictions imposed again to try to keep outbreaks under control. So we will continue to talk to the UK government. We are in the position where our funding is finite because we don't hold the borrowing powers that the UK government holds, so we need to either look to them to deliver schemes that will result in consequential funding or give us additional borrowing power so we can do more of that ourselves, and we'll continue to take forward those discussions, and I hope they will be constructive and positive discussions. Alan Smith from Bauer.
Thank you, First Minister. Just in relation to the cases that we're seeing in Greater Glasgow and Clyde, with that now being over 100 positive cases in the past 48 hours, the fact that these seem to be linked to smaller clusters, does that mean it's unlikely we'll see a lockdown in Glasgow that we've perhaps seen elsewhere? And one for the Deputy First Minister. The Scottish Secondary Teachers Association has told Radio Clyde that pupils who fail to wear face coverings should be sent home. Do you agree with them?
I'll hand over to John in a second. In response to the first part of your question, I think we've got to be increasingly careful about using lockdown as some kind of blanket term, a one-size-fits-all approach. We have to take steps, if necessary, to deal with outbreaks, and those steps have to be tailored to the specific causes and circumstances of outbreaks. So if you think back over the last few weeks, in Aberdeen, we had an outbreak that very definitely appeared to have started in and then spread amongst the nighttime economy in pubs, for example. And therefore, part of what we had to do there was restrict hospitality. In Cooperangus, we had an outbreak with a large number of cases similar to the number of cases in Aberdeen, but a very different outbreak in nature. It started in a workplace and in a factory. So the measure that was appropriate there was to advise isolation, not just of the workers in that factory, but also their household contacts. And so far, it looks as if those measures there have had an effect, just as the measures in Aberdeen had an effect. So when we're looking at other areas, whether and what measures we take will depend on the nature of the transmission and whether or not we think it is under control or potentially running out of control again. And then we will try to tailor our response. So we won't see necessarily the same approaches being taken in every area. What if I take the example of Ayrshire and Arran right now, it appears on what we know right now that these are small clusters that haven't started in hospitality, but instead in indoor household gatherings. So that will obviously shape any response that we're trying to fashion to this. And that will be the nature of the weeks and months that lie ahead. We will have to tailor our action as far as possible to meet the circumstances. So all of that no doubt gets encapsulated in the catch-all term lockdown. But lockdown, increasingly means different things in different circumstances. And of course, we want to avoid any restrictions if we can, and the best way to avoid restrictions being necessary is for us all to act in a way that limits and avoids transmission in the first place. As I keep saying, test and protect, imposing restrictions, if you think of test and protect as the second line of defence if an outbreak starts, if that can on its own completely contain it, then we have to think of further restrictions, and that becomes the third line of defence. But the first line of defence are all of us doing all of the things that are encapsulated in our advice, and that is why I feel as if sometimes I want to scream it from the rooftops that we all have to follow all of this advice, or we're going to see this virus spread again, because it doesn't go away. It spreads if we give it the chance, and we've got to avoid giving it that chance. John.
In relation to the issue of face coverings in schools, one of the objectives of the decision on face coverings in schools has been to increase the safety of our schools for young people so that young people can continue their full-time face-to-face education in as safe a fashion as we possibly can do. So we've got to make sure that the wearing of face coverings in schools becomes essentially a habitual part of school life where it is appropriate for that to be undertaken. And in our guidance, we make it clear that young people should be encouraged and motivated and required to do that, but it should not result in exclusion from school if they don't do that. So on the sharp point of the question, I don't agree with the SSTA that young people should be excluded from school if they're not wearing face coverings, but I do think schools need to build up the cultural understanding and awareness of the importance of wearing face coverings as something that is done to protect all of the school population, staff and pupils alike. And in that respect, encourage compliance with the policy approach because of the recognition amongst young people that this is the good and the right thing to do.
Thanks. Jack Foster from Global.
Good afternoon, First Minister. Students are now arriving in Scotland ahead of what will be an uncertain time, to say the very least. We know the concerns surrounding the start of a new term, and we've heard, obviously, warnings that universities could potentially become infectious hotspots, not to mention recent high numbers of new cases. I wonder, though, if you had a message for those young people who are taking that step and arriving in the country, perhaps for the first time, unsure as to what the next few weeks, months, or even potentially years will hold.
Deputy First Minister will publish updated guidance for universities and colleges tomorrow that will cover all of the things we're asking universities, colleges, student accommodation and students themselves to do. I would remind international students, if you're coming from one of the countries on our quarantine list, you have an obligation to quarantine for 14 days. That is the most effective way of stopping the importation and spread of the virus from other countries. But the guidance will also look at the use of face coverings. It will look at blended learning and the limits that we advise on face-to-face teaching, all measures designed to minimise and mitigate the chances of this virus spreading. There is no doubt every step we take to get back to normal, we create risks of the virus spreading, and the return of universities and colleges is another significant point where if we're not careful, then we will see outbreaks. And the responsibility is clearly on institutions to make sure their students and staff are following all of the guidance, but there's an obligation on individual students as well. I want students to come from all over the world to study in our world-class universities and colleges, but I want them to be safe when they are here, and I want all students to enjoy their university college experience, but in this unique time we are living through, to understand the importance of following all of the advice that is given to them. That doesn't make for, I know, a normal student experience, but it is absolutely vital if we are to keep this virus under control. And whether it's to students or young people more generally or to the population at large right now, every time one of us breaches the guidance that's in place, we are giving COVID the chance to spread, and we are increasing the risks of us all having to go back the way. So I really keep stressing this, and I will continue to stress it because it is so vitally important. Do you want to say any more about universities?
Can I just say a couple of additional points, First Minister? The first is that the guidance that we publish tomorrow will cover the university and college environment, and crucially also the accommodation environment in which young people and students will be coming to live. And it's absolutely vital that there is the deepest level of compliance with the guidance that is put out covering all of these educational and living circumstances that will affect students. And the second point is really to take forward one of the comments the First Minister made, and that is that the environment will be very different to what students would normally expect to be coming to, and it should be very different to the environment that students should be expecting to come to. We want to make sure that students are welcomed into their university or college campuses, but that must be done in a safe fashion, and that will require a great deal of compliance to make sure it's the case.
Fiona from Original 106.
Hi there. An Aberdeen bar shut at the weekend after claiming the music ban in pubs is suffocating the nighttime economy. You mentioned you wanted the furlough scheme to be extended, but with no sign of that happening yet, could you be faced with making a decision between protecting public health and protecting jobs, and which one will you choose?
It's not a trade-off like that. If we don't protect public health, the economy suffers. And obviously, if we don't support the economy, then the wider implications for health are well known. I've never seen, and people who've listened to me day in and day out over the past 6 months will know, I've never tried to see it as a choice. If we don't get both of these things right, then we don't go in the direction we need to go in. But what I would say to businesses in the hospitality trade or anywhere else, if you're still trading under restrictions right now, that is not because I want you to be trading under restrictions. It is because the restrictions that we have put in place, we judge are necessary to stop the virus spreading. And in hospitality, to keep background music or to not have background noise in music is to try to avoid a situation where people shout or lean into other people in order to be heard, because these risk transmission. Now, we said, and this work will be taken forward, we want to talk to hospitality to see whether we can agree a safe decibel level, something that I'm sure is not easy to do. But we want to always be striking the right balance. But, you know, I'm standing here today reporting the highest number of cases in a long time. This virus is still a threat. And if we don't take that threat seriously, then we unfortunately will end up back in a situation where it's not, not being able to have music that hospitality is having to deal with. It's not being able to open at all that hospitality will be having to deal with. I take no pleasure in any of this. I, just like all of you watching, I so desperately want us to turn the page on COVID and move back to normal or build a new normal. But if we take our eye off this ball, we are going to end up in a really difficult situation again with it. So we've got to just all take these things seriously. And that applies to businesses being asked to operate under restrictions, just as it applies to individuals and members of the public who are being asked to live their lives in an abnormal, restricted way. If we forget all of that, then we're back to square one, and nobody wants us to end up there. Do you want to add anything in terms of transmission risks?
I think there are clearly the transmission risk of COVID we see is quite exceptional, and we've seen the devastation it's had. There are some good things about the virus. It is easily destroyed. So it's easily destroyed by hand washing or using hand gel and by cleaning surfaces. It's also transmitted in droplets, which means the droplets are heavier and drop to the ground. So therefore, the 2 metre distance, ideally, and the face coverings can also protect people. But the aerosol, this very, very small particles that sit in the air, that we often see with the winter vomiting bug, which makes that infectious in a different way. COVID can be caught in aerosols and sit in the air. And again, that's why whether it's coughing or singing or shouting and making people be less than the 2 metres, never mind less than the 1 metre, then means that it is highly transmissible. And as we've seen, it can then start spawning and spreading across. So we need to take advantage of COVID's weaknesses, and that is easily killed by good hygiene, and obviously more difficult to spread with good social distancing. And therefore, what happens around us is important in terms of noise and other factors as well.
Tom Eden from PA.
Thank you very much. Good afternoon, everyone. Probably for the Deputy First Minister, I was just going to ask what you found to be the biggest challenges reopening schools. Have there been any unforeseen surprises in the last couple of weeks? And with English schools reopening this week, what advice would you offer English local authorities based on what you've learned?
Thanks very much, Tom. I think that the key point that we've learned is the importance of having the clearest guidance available that can be applied in all educational settings and configured to make those educational settings safe. We've managed to reopen our schools in full. All schools have been able to be reopened. We've had a small number of cases which have essentially been of outside community activity that has led to cases presenting in schools, but that's been very, very much in the minority. So we've seen very good levels of compliance with the guidance by schools. We've learnt in the course of the last few weeks that in secondary schools in particular, crowded corridor environments are quite difficult to manage and difficult to change when you've got large movements of individuals. Hence the change to our guidance to put in place the requirement for face coverings to be worn in such circumstances by secondary pupils. But on the whole, I think our education system has adapted very well to the different arrangements. We're continuing to monitor on a regular basis all of the experience that is taking its course, and if there are any further changes required to guidance in the period going forward, we will undoubtedly make those changes.
Thank you. Rachel Watson from the Daily Mail.
Thank you, First Minister. I just wanted to go back to the clusters. For weeks now, you've stood on the podium and told us that we should stick to the rules regarding indoor meetings. But obviously there are a number of clusters now across the country where you say the problem has come from indoor meeting. Do you think people aren't taking this as seriously anymore and are ignoring what you're saying to them? And if so, why? And does this risk us going backwards, for example, the rules changing so that we can't meet others indoors anymore in our own homes?
Yes, there is a risk of that. I hope, fervently hope we can avoid that, but I can't rule out that possibility. I think the vast majority of people are still trying to do the right thing. It gets harder with every day that passes. I know that from my own personal life, so I understand it for everybody else. And I do think there are some people, and again, I don't mean this as a criticism, I think it is human nature and perfectly understandable. Some people who think the threat has passed, and there are perhaps also people right now who are seeing a rise in number of cases, but not yet a rise in hospital or intensive care admissions, or thankfully in deaths, and think, well, it's less serious than it was earlier in the year. And I think that complacency is really dangerous. We, in truth, don't know yet if this rise in cases, whether it will or will not lead to an increase in serious illness or death. I think we should assume that it will to some extent. So that underlines the need for us to try to act in a way that stops it transmitting in the first place. And you know, I can't stress enough how important all this is, and that unfortunately is going to be the case for some time. And if we all do these things voluntarily, then we've got a really good fighting chance, backed up by Test and Protect, of keeping this under control. But if we don't, then unfortunately we may end up back in more formal restrictions being imposed. So in a sense, it's down to all of us. And you know, I know that's easy to say, a lot harder for people to deliver on, but it is down to all of us. And therefore, for as long as it takes, and however loudly I need to say it, I will continue to ask people to do all of these basic but necessary things in order to try to keep these numbers down. And, you know, I hope people will continue to comply. And people who haven't been complying, I hope they will rethink and change their ways in the future, because, you know, we're all in this together. And we're only, you know, I keep talking about all of us as the first line of defence. Like any line of defence, you're only as strong as your weakest link. Every time one of us is a weak link because we do something that allows the virus to spread, we compromise our overall defences. So I take no pleasure in any of this, but it is really important that these messages get out there. Chris Musson from The Sun.
Good afternoon, First Minister. Given today's figures and your new modelling that's estimated levels of the virus in Scotland are higher than previously thought, is the effective elimination strategy you've spoken of now unrealistic without a vaccine? And related to this, could the increased testing that we've got now be showing us that there's much more virus about than we previously thought?
No, the elimination strategy remains important. The more you try to eliminate, and remember, elimination is not eradication. Eradication is when it stops being a threat altogether, and that unfortunately probably will depend on an effective vaccine. But elimination is about trying to suppress it as far as you possibly can. And it's one of these things that if you stop trying to do that, then you know you'll get higher numbers of cases. continuing to try, you might still get outbreaks and clusters, but the process of trying to eliminate helps you drive that and keep that as low as possible. So we absolutely must keep that, zero COVID elimination strategy firmly in mind. The higher testing is definitely a factor here, and there are other leaders elsewhere in the world who kind of try to say that we're testing more, so finding more cases, so therefore it's nothing to worry about. That is not my view. It is the case that as we test more people, we will find more cases, which is why it's important to continue to test as many people as clinical advice recommends that we do. But it's the overall positivity rate that I certainly look at first every day. That is still below 1, and there's been a couple of days in the last couple of weeks where it's been slightly above 1, but remember the WHO says that you want to have that below 5%, so we're well underneath that right now. But whether that reflects the fact that there's more virus out there than we think, or that as we release lockdown, the virus is transmitting more again, it will be a combination of that. But for us, the objective is to find cases wherever we can, as often as we can, and then put the protective ring around them through contact tracing and isolation. This is not easy to do, but in theory, there's nothing complicated about it. It is just about trying to isolate this virus as much as we possibly can. And the good news is that in the outbreaks we've seen so far, that has worked. Aberdeen, Couperangus, effective contact tracing there. But the more of these clusters we seed, the more difficult that becomes to keep them all under control. So it all comes back to what all of us have to do to try to make sure it doesn't get a grip in the first place. Conor Matchett from the Scotsman.
Thank you, First Minister. Primarily a question for the Deputy First Minister, if possible. I've been speaking to an academic who's involved in the work of SQA, Where's Our Say? And this is going back to the exam results issues previous in the year. Dr. Tracy Kirk says that the appeals system is still not fit for purpose, and it's contrary to the Getting It Right for Every Child framework that exists. She's calling for, and the group are calling for, direct appeal systems for pupils who believe that their teacher estimates were too low, and they might be considered coasters, if you like, students who pull it out of the bag at the last minute in exams. Mr. Swinney, if you could, do you agree with that? Do you think that there should be a change to the appeal systems, especially as doors shut for potential university students on the 7th of September?
On the SQ have put in place appeals routes which enable young people to go to their school where they believe there are circumstances that merit an appeal, and schools can take forward those appeals to the SQA. Now, we obviously changed fundamentally the way in which we certificated this year and significantly expanded with a major increase in the pass rate at National 5 Higher and Advanced Higher, the number of young people being accredited with qualifications. So I think the arguments for further expansion of the appeal system, to me, don't seem to be strongly borne out by the changes that were made in the grading approach that was taken by listening very carefully to the feedback from individual teachers. Now, that obviously the universities are making their judgments about places, universities and colleges are making judgments about places that are available for young people. The government has made clear that we will expand the places, we will fund the expansion of places to enable more students to be accommodated within our universities as a consequence of the fact that more young people will have passed the threshold for accessing universities than was the case beforehand. And our discussions with universities are ongoing about how to put that into practice and to make sure that more young people can be admitted to universities. And the data that I'm seeing indicates that that is the case.
Tom Peterkin from the P&J.
Good afternoon, First Minister. You said earlier that the workforce at the Two Sisters factory in Couperangus will be able to stop self-isolating by the end of today, and that the factory will restart work tomorrow. But you also suggested there may be some within the workforce of their contacts who may have to self-isolate further. Can you Are you able to say what sort of proportion that may be?
I can't. I mean, that will be very much based on advice of the incident management team and the contact tracers. You know, in broad terms, if maybe Fiona wants to elucidate a bit more on this, but in broad terms, if somebody perhaps tested positive throughout the period of isolation so far, and therefore they have a period of isolation from their positive test that goes beyond the 31st, then that would be one circumstance in which they may be advised or would be advised to isolate further. But I don't know what the proportion is. I would expect the majority of staff will be able to end their isolation at the end of today, which is the date that was advised firstly.
The First Minister is absolutely right. It's a diminishing number who will not be able to return to work tomorrow. We know that it can take up to 14 days for symptoms to develop following a contact, but we also know the most likely time to become infectious after a contact is between 3 and 7 days. So most people will have either have developed symptoms and know what their period of isolation is, or that will not have developed symptoms and will be able to return to work. But it will be a diminishing number as the curve has followed an increase at first and then the gradual decrease as the number of positive cases decrease because the Test and Protect team have brought things under control.
Mark McLaughlin from The Times.
Good afternoon, First Minister. You may have read in the Times this morning, Police Scotland have released their latest crime figures for the period over the first few months of lockdown, showing online child sexual abuse is up, drug deaths up significantly, even higher than Scotland's awful figures that we see year on year. I know these are absolutely brutal trade-offs, but do you believe, having seen these figures, which were anticipated, that these trade-offs were the right trade-offs, and would you make them again if we have to go into another lockdown?
I will, for the rest of my life, ask myself questions like that. All I can say is we have acted, the Scottish Government, I as First Minister, have acted in a way every single day to try to make the right balances to keep people as safe as possible. If we hadn't done some of these things, the virus would have taken an even greater toll than it has, and it has taken a considerable toll. But we always knew and said all along that lockdown would have its own impacts and consequences. And, you know, all I can say is I hope, and I'm far from the only leader of governments the world over that's had to make these invidious decisions over the past few months, and I just hope the next generation of leaders never have to face this, because there is no absolute right and wrong way. And you know, as I say, I will probably spend the rest of my life wondering whether I could have done things differently, but I've tried to do the best. And what we know is that we need to mitigate the consequences of lockdown. You know, trying to come out of lockdown is important to stop those consequences, but in a whole range of ways to mitigate them. On drugs deaths, for example, we said all along that health boards should continue with drug treatment because of the importance of that. So right throughout the period of the pandemic, the Drug Death Task Force has also continued to meet throughout the pandemic. The police, the Chief Constable has commented on this when he stood here before, have made sure they have a continued focus on domestic violence and child abuse. There's been a whole range of work which John can talk a bit more about to make sure that vulnerable children were not slipping through the net. So there's all sorts of things that we've tried to do to stop these consequences, but we are, you know, heading into a period of recovery, I hope, if we can keep the virus under control, where we will need to repair some of the impacts that the virus has had. But this has been, you know, a horrendous period that we have lived through, where we have been balancing different harms and trying to reduce the harm overall. And I don't think there is a leader of any government anywhere in the world that would ever tell you that that is a position they want to find themselves in, when all you're trying to do is find the lowest overall balance of harm that has been done to the population. And it's getting out of that, getting away from that, which is why I'm so determined that we do everything we can to keep this virus under control, because I don't want us to go back to having to make these kinds of choices.
All I'd add to what the First Minister said is that throughout lockdown, there has been a very sustained effort undertaken by local authorities and Police Scotland to make sure that we maintain the focus on young people, children, who were on the Child Protection Register, and that they were provided with the support and the access to assistance that they required. And over the course of lockdown, we looked at data to determine how frequently that was happening, and essentially well over 90% of children on the Child Protection Register, going away back to April, were being seen by social workers or contacted by social workers over that period. Now, that number rose steadily as we worked our way through lockdown, and of course we're now in a position where there is much better opportunity to have dialogue with children who may be the victims of harm. One of the things that we've seen, of course, with the resumption of full-time schooling is greater contact between children and trusted adults. And we expected that to result in an increase in contact and concern, and obviously that has been pursued as part of the normal arrangements for child protection and support, which is absolutely critical that we deliver in every circumstance within Scotland.
Thanks. And lastly today, Tom Gordon from the Herald. Can't hear you, Tom.
Hello, can you hear me now?
Yeah.
Yeah. A question to each of you, if I may. First Minister, you mentioned tailored actions in response to some of these clusters we're seeing. Are you thinking along the lines of perhaps postcode lockdowns? I mean, Glasgow obviously is an enormous city. If there were a cluster of cases around Bars Road, for instance, would it make sense to shut pubs in Drum Chapel and Easterhouse? Could it not be done on a more subtle level? And to the Deputy First Minister, before we even get to students returning to lessons at university, we have to go through Freshers' Week, which is obviously a rite of passage. Do you have particular concerns about Freshers' Week, and are you taking any in talks with universities or student associations about that?
I'll hand over to John on Freshers' Week. It will depend on the circumstances. I'm not going to start speculating about individual areas, because if we have to impose restrictions in any area, it's better that I come here and announce decisions as opposed to speculate. But we would always want any restrictions to be as narrowly focused as possible and as proportionate as possible. So we start on the basis of how narrow can we keep this, but obviously it has to be wide enough to do the job of stopping greater transmission. But the whole point of saying it would be a tailored response is absolutely driven by the circumstances and the nature of any outbreak that we're facing. I, over the course of today, hope to see further analysis of today's cases, in particular in Greater Glasgow and Clyde and Lanarkshire, where I suspect, given the geographies there, that there could be, I don't know for sure, but there could be some overlaps and linkages. And then we'll base decisions on what the data and the evidence and the clinical advice tells us. But we will also always try to keep that as limited as we possibly can.
On the question of Freshers' Week, Tom, in short, yes, I do have concerns about Freshers' Week. There have been extensive discussions between the government, the universities, colleges, student unions and with the NUS about the measures we've got to put in place to try to ensure that Freshers' Week is undertaken in a different fashion to what I think most students would have experienced over time. We have to be conscious of the risks that come from large-scale socialisation. Obviously, the heart of the guidance that is going out is the fact that blended learning will be a presumed model for the delivery of learning. The purpose of that is to reduce the number of students on campus, and that is clearly one of the points that we wish to pursue in relation to the whole concept of opening up higher and further education for this academic year. So I understand how exciting and thrilling the prospect of coming to university is for students. Freshers' Week is very much part of the character of that experience, but as we have laboured throughout this pandemic, this year is different, and it has to be pursued in a safer fashion where we follow guidance and we take steps to make sure that everyone is keeping safe, and that will be the approach that will have to be applied during Freshers' Week as well.
Thanks. That concludes the questions for today. Thanks to all the journalists who joined us. My thanks to John and Fiona for helping me with the answers, and thanks to Robert for doing our BSL interpretation today. Can I just alert you to the fact there is no 12:15 briefing here in St Andrew's House tomorrow. Instead, I will set out the government's programme for the year ahead in the Scottish Parliament. As part of that, I will give the statistical update, but then set out our proposals after that. You will get on the Scottish Parliament, if you're interested, the precise time of that. From memory, I think it's sometime after 2 o'clock tomorrow afternoon. Can I just end, I guess, by appealing again to everybody to help us in keeping this virus under control. There is literally not a single day since I think the 1st of March this year that I've not pored over COVID statistics, considered the Scottish Government's response, made really difficult decisions about how we try to keep it under control. And there's not many days that I've not stood here and shared our thinking and conclusions with you. There have been some really dark moments along the way since the start of March, and more recently there have been moments of greater hope and optimism, and I have always tried to be frank with you about my assessments and feelings about the situation that we are in, which is why I feel able to say to you today, and feel that it is important I say to you, that I feel a greater sense of anxiety today than I have done at any time probably for the last couple of months. We are in a fragile position. We have substantially lifted the lockdown restrictions, but in doing so we've allowed this virus opportunities to spread, and we are trying to keep it under control now, not by a strict and very restrictive lockdown, but by all of us doing the right thing and by having Test and Protect and local health protection teams coming in to contain outbreaks when they happen. But unless all of us do the right things, that will be very hard to do on a continuous basis over the weeks and months ahead, particularly as we get into winter. So I just end by asking everybody again to think very carefully about how you're living your lives at the moment. I take no pleasure in asking you to do that, but it is vital. Please think very carefully about indoor gatherings. Stick to the limits. They are there for a reason, and make sure if you're meeting people from other households indoors, you're not just sticking to the limits, but you're being rigorous in hand hygiene, bearing in mind what Fiona said earlier on about how we can kill this virus through good hygiene and cleaning surfaces. And make sure you're physically distancing, because that is another way of stopping it spreading from one person and one household to another. None of us want to live our lives in this way, but by doing that, if we keep the virus under control, we are avoiding a much worse outcome, which is going back to the more restrictive situation that we saw earlier in the year. So please, everybody, do all of these things. And if there are people you know in your families, your friends, groups, in your work networks are not doing all of these things, then perhaps take the opportunity just to appeal to them to change their ways. We will succeed or fail here in beating this virus collectively, and the behaviour of each and every one of us really matters to the well-being of all of us. So my thanks to everybody who is watching and who follows all of this advice. Please help us in making sure that the majority of people across the country are doing likewise. I'll see you from the Scottish Parliament tomorrow and back here later in the week. Thank you very much.